going to say, if you're in the downtown core and something unfortunately happens, you could say, is there a doctor in the house? And likely there's someone within a couple of feet from you that's a doctor. There are about just over 1,600 that are actually here, rolling conferences over at the Ottawa Convention Centre. Joining us, the CEO of the Royal College of Physicians and Surgeons of Canada, Dr. Andrew Padmos. Great to have you here.
Thank you, Leanne.
And really sounds incredibly interesting, the movement that's happening, the conference that's happening right now at the Ottawa Convention Centre.
Well, it's new and different, and it's a part of medical education that people perhaps don't know much about. We know a lot about medical school and graduating doctors. We know about people in practice, but it's that in-between where they get their practical experience and are certified to go out into practice as a specialist. That's residency training, and that's what our conferences are all about.
Residency is that crucial part, right? You finally left the textbooks and school, and this is really the integration into the actual field of practice.
That's right, and it started in the 19th century, where junior physicians would attach themselves to a practicing specialist and move into the hospital and stay as a resident for a number of years in serving on that practice in order to gain the wisdom and the experience from their supervisor and tutor.
What are these residents then at this conference going through in terms of understanding the new aspects of medicine, or where their passions lie, or what's available?
Well, the system of training resident physicians, which again started in the 19th century, has served us well in the 20th. The doctors that we produce, whether they're family doctors or cardiac surgeons, are incredibly well trained, and Canada's known for its framework of education. But the needs of physicians are changing and need to be more responsive to issues like quality and patient safety, communication with vulnerable and marginalized populations, attention to social determinants of health, and most importantly, working in teams with other health professionals. So the training needs to respond to those cues and those requirements and modify itself over time.
I have to admit, one of the things that, you know, besides the television programming that seems to follow the medical kind of dramas, is that residencies, it was like a full-time 24 hours, hardly on any sleep. There was almost this, you know, thought process as to what goes on within that residency program. Is that false how we see things?
Well, it's an intense experience. Not that medical school is easy. Medical school is about learning knowledge. Residency is about applying knowledge to real patient encounters. And it does take time. People need exposure to cases. They need to look after people from the time they present with an illness to the time they go home recovered from that illness. And during that time, they have to study and expand the depth and breadth of their knowledge as well. So it is require a lot of focused attention and very hard work and dedication.
Do we have a good number of residents coming up, learning from those that have all of this experience, so that once they're retiring and moving out of medicine, that the new stock are well trained, well educated, and ready to take that on?
I think we're training some superb young physicians and surgeons. I think there are questions as to whether we're training the right specialties and disciplines. For instance, do we need more cardiac surgeons, or do we need more family doctors? And Canada doesn't have an overall strategy or capability to modify the output of our training programs perhaps as quickly as we should, and we are working on that.
Those are some of the topics that are being discussed at this conference then.
Absolutely. Things like general physicians. We want people who are able to work in smaller towns and communities rather than feeling they have to work in a super subspecialized environment like the Ottawa Hospital. We need doctors everywhere.
Well, I think you're seeing a lot of probably wonderful ones this weekend. Congratulations on the work that is being done and everything going through the Royal College of Physicians and Surgeons of Canada, royalcollege.ca, the information listed below. Back to work.
Thank you. Back to work.
Back to work.